Streets have been changing for a long time now, and we've been talking about that on You and Yours for a long time now. There are fewer shops, there are more cafes, and in future, there may be much more healthcare available on the high street. New NHS treatment and advice hubs should be springing up soon. The idea of moving health services out of hospitals and closer to where people live is part of the government's 10-year plan for the NHS in England, and the aim is that there will be 200 new community health hubs. There are about a dozen of them now. The Living Well hub in Warrington opened just over a year ago. It's in the town centre. It's in walking distance from the central train and bus stations. Caroline Williams is the is the Executive Director of People at Warrington Borough Council. She oversees children's services, adult social care, education and public health. And Lucy Gardner is the Director of Strategy and Partnerships at the Warrington and Halton Hospitals NHS Foundation Trust. Hello both and welcome both. Lucy Gardner, tell us then about this new Living Well hub. What services does it provide?
So the Living Well Hub, as you say, opened just over 12 months ago, and we provide a really wide range of clinical and non-clinical services to support people's health and well-being. So we currently have over 70 different services provided by 40 different organisations, and it includes specifically those types of services where we know that the people in Warrington perhaps have poorer outcomes. So focuses on things like women's health and people who are getting older and early signs of dementia, also families and children and mental health support. And it also has a staying well offer, so that more preventative side of healthcare, focusing on things like blood tests, health checks and support with diabetes.
It's been going, as you say, for over a year now. How many people are using it?
So we have about 2,500 visitors to the hub each month.
And has that grown suddenly, or was this the great roar of business from day one?
So it grew probably over the first couple of months. So we started off with about 200 people visiting each week, and that grew quite quickly to about 500, and we're seeing continued growth even now, 12 months on.
Caroline Williams, why the town centre location?
It's really important to make health services as accessible as they can be. So the hub is right in the middle of the town centre, is easily accessible, and people can either walk there or catch the bus there. So it's just there on the high street, such that people are able to drop in. And I think that's really important, that about half of our appointments are booked and half are just people dropping in to have a conversation, perhaps not purposeful in knowing what they need, but having a sense that they need something. And it's a really welcoming, comforting environment to start that conversation, to explore what people might need, and to be able to best connect people with the services that they most need, and particularly in a more preventative, planned way, rather than in a crisis or in an emergency.
Caroline, we followed the fortunes of Warrington Town Centre during the pandemic, and a lot of businesses at the time were struggling. Have you seen any greater prosperity in the businesses around the new hub? Obviously, it will increase footfall, but does it increase spending?
So you're right, we have a vibrant town centre in Warrington on the back of significant investment from the Town Deal programme, and some of your listeners might be aware that we have an award-winning marketplace in Warrington, where similarly we're seeing footfall increase year on year into the town centre, which in turn brings prosperity into the town, and the more people that are spending their pounds in Warrington, the better that is for the town.
And it's happening?
Yes, indeed, yeah.
Tony Goodman's the Marketing and Strategy Director at Place Informatics. It's a company that studies location data, and he's here with me in the studio. Tony, are you noticing this shift then towards healthcare being provided on high streets?
Yes, and we've been seeing it going on for a few years. Just to give you some examples, as well as the Living Hub in Warrington, in Aylesbury, Health on the High Street opened in the local shopping centre a couple of years ago. In Stockton, Tees Valley Community Diagnostic Centre opened. And only a few days ago on BBC News, there was an article from Rotherham about a health provision replacing retail outlets on the high street, and the local councillor saying how important that was to maintaining the health of their high street.
Are private health companies doing this too?
There's always been private provision on the high streets with pharmacies, opticians, and even GP surgeries. But certainly we're seeing a lot more with gyms, private clinics, physiotherapy, mental health support, rehabilitation facilities, and wellness studios. Those are opening on high streets closer to local communities and sometimes inside major chains.
What are the benefits for surrounding businesses, or will these places replace businesses that are lost?
Well, there's multiple dimensions to answer this. Locating provision where people already go makes it far more convenient for them. For instance, there's likely to be good access to public transport and parking. But there's also benefits for the high streets and their neighbours, whether that be a retail park, a shopping centre, or an actual high street. And that benefit expands to the other businesses, to the councils, and to the landlords. As bricks and mortar retail is being usurped by online provision, we've seen many stores, well-known names and smaller chains closing for a considerable amount of time. And replacing those businesses to keep the high streets and so on vibrant, there's only so many coffee shops and restaurants that a high street can support. So health centres have the advantage that they bring significant additional footfall, which creates a halo effect for the other businesses, supports the economy, and ultimately helps ensure the survival of the high street.
Lucy Gardner, you talked about making this new place in Warrington somewhere where you could just call in for a chat, I suppose, for preventative medicine if you just felt uneasy and so on. Has it made any difference to the numbers who are turning up at Warrington General Hospital Accident and Emergency Department?
So over the same period of time, we have seen about a 4% reduction in the number of people attending the emergency department at Warrington Hospital. It's quite difficult to say that that's wholly due to the Living Well Hub, but we have also started to survey people who are accessing the hub to understand what would they have done if the hub hadn't have been there. And certainly a number are saying they would have gone to the emergency department. So we are seeing some positive impact.
Caroline Williams, I know that this hub has gone into a building that belonged to the local authority and was a drop-in centre, I think, for local authority services. Will that be a problem for other people trying to replicate what you've done? Where will you put these places? Because a lot of what we have in high streets are buildings that are big, retail centres that are empty, that nobody wants to take. They're not the kind of places that you would put a modern health service, are they?
So we looked extensively across a number of buildings that we had available to us in Warrington, and you're right, the current hub is in what was the old contact centre. I think what's important in the design of our hub and for other hubs is the size and scale of the building is about the right size to accommodate both clinical and non-clinical services. And I think most importantly, it has that welcoming and open feel to it. So I think it's as much about the environment that you create within the building itself as the fabric of the building.
How many years has it taken you to get this off the ground?
So we benefited from the Town Deal
Yes,
programme.
you mentioned that. What is the Town Deal programme?
Yeah, so it's a programme and some investment that we've been able to draw into the town to support the development of this hub and other facilities within our town. So we were in the planning stages probably for around about 18 months before we actually, as Lucy says, went live.
Well, not long.
A year ago.
Okay. Congratulations, Caroline Williams, Lucy Gardner and Tony Goodman. Thank you very much for that. Thank you.